Hello everybody, my name is Craig Norman and we are broadcasting to you live from the Global Specialty Lens Symposium in Las Vegas. We're very excited this morning to have Dr. Tom Arnold with us to talk a little bit about the Eaglet Eye Surface Profiler. Tom,
Hey,
how are you?
my pleasure, Craig.
It's great to have you here. You know, Tom, of course, you're really viewed, rightfully so, as one of the true experts in scleral lens fitting today. And to do that, you need tools, right?
Exactly.
You need to have certain things to be able to design the lens, follow the patient, and so on.
Absolutely.
Can you tell us a little bit about how you use the eye surface profiler in your practice?
Sure, happy to. I'm very technically oriented. I always like to integrate new technology in my office. I always have. We have a robust scleral lens practice. We use a variety of different lenses depending on the patient needs. And so as a busy practice, we're a 3-doctor practice. It's very important to be efficient, you know, both from a patient management standpoint and from a confidence standpoint. As I've been fitting scleral lenses these last few years, when you become known as a specialist in that area, you attract harder and harder cases.
Sure.
And so these cases become more time consuming. And if you can streamline that process, both for the office and efficiency as well as the patient experience, any technology that does that is useful to us.
Sure. Now, of course, this helps to measure a really wide area of the ocular
Absolutely.
surface, and that helps in lens design for you to come up with the initial lens. And then how do you use it from a practice management standpoint? Do you actually show the pictures to the patient?
We do
talk
sometimes.
About what's going on?
Yes, there's a variety of maps that are very, very good. There's a 3D image and stuff, and it helps the patient understand their complexity of their situation. The reason surface profilometry is so important to us is we don't fit the cornea. You know, this is not topography or tomography. We need to establish what kind of cornea we're dealing with, whether it's keratoconus or a post-graft or whatever. But we actually fit the sclera. And you know, experts, I was just listening to Jason Jedlicka this morning, you know, what we're doing without measuring the anatomy of the sclera, we're fitting blind. It's like fitting a cornea, not taking any K readings or anything. So, and we have been fitting blind all these years.
Sure.
So if we know, and recent studies have shown that the sclera is highly irregular, as much as 60% of all scleras have no relationship to corneal topography relationship, very asymmetrical. And so that being the case, you know, sometimes it takes 2 or 3 or 4 trial lenses, you know, to look and get situated what is the best fit. But with Eaglet, what's really tremendous about it, you take several images, the software tells you what's going on, you know, with the anatomy of the sclera, and how we use it in the office is then we select what we think is the appropriate lens. And one of the nice things about this product is it's not lens specific. There's a variety of lenses which we use, and we can select the lens we think is appropriate. And with the software, it'll tell us your first trial lens should be this.
So
we
for
find it's
instance,
happy, very accurate.
You can pick a lens, and then
Exactly.
you know, once you've chosen the lens, it will, or excuse me, the product, and then it will point you to what the first diagnostic lens should be to put on the patient's eye.
That's exactly right.
And so, of course, you make an excellent point. In the world of contact lenses, for years it's been about keratometric readings. Okay, 2 to 4 millimeters for these kinds of lenses, scleral lenses, they're totally meaningless. Right?
Exactly.
Topography, 7 or 8 or 9 millimeters in size, right?
Right.
Helpful, but still not helpful enough. How wide of an area can this measure?
Well, it's all, patient compliance is very important, and also it's very important to train your staff and have so you can get up to 17 millimeters in each direction. You got to use a lot of fluorescein,
Sure.
very dark light, but it's very quick, and it's very user friendly. My staff took to this immediately. It's very easy to use. Straight ahead gaze. We don't have to use multiple gaze images. And it's very easy and it's very effective. So we get out to 17 millimeters with a cooperative patient. But you know, it's an interesting fact, Craig, that many different diameters of lenses, actually their landing zones are quite narrow.
Yeah.
So even though you may be fitting a 15 millimeter lens or a 16 or maybe even a 17, where they land is what's important. And so that zone is fairly narrow, and so this instrument easily gets out to that.
Sure.
in most cases.
And do you use the eye surface profiler any time after the fit? Or are you using it primarily to tell you where you're beginning to choose your lens and to choose the fit?
We may do that on a follow-up. If we're having any difficulties, we may go back and reassess, to make sure we're accurate. But it's pretty much a diagnostic instrument to help us with the first-time lens fitting. One feature that I'm very intrigued with, and maybe I'm jumping ahead, but I think the future of scleral lens fitting is empirical fitting, because we have all these trial sets that are expensive to maintain. We worry about contamination issues. How many fitting sets do you need? And they're time consuming. And so what my goal, and this is starting to happen with Eaglet, with some of the manufacturers, is we want to take the refractive data, we want to take the measurements, we want to select the lens, and we want to order that lens. And we been doing this for many years with rigid gas permeable lens fitting. I don't do trial lens fitting of rigid gas permeables. I take the data and I order the lens, because you want that first lens to be a good experience.
Well, that's the whole thing.
Exactly.
That you can take a diagnostic lens and put it on the patient's eye, and you can talk to them about how good it fits, and all they're thinking is, I can't see.
Exactly right.
And so the ability to, through empirical fitting, take that first lens, put it on the patient's eye, and it's the wow factor of, wow, not only don't I feel this lens, but now I can see.
In some of the scleral lens patients, candidates that come in with very distorted vision, like a severe cone or a post-graft patient, you can tell them that this is a diagnostic lens, we're doing the fitting, and we're going to come over the refraction. But sometimes that just doesn't get through.
Oh, they're not hearing that.
They're not hearing that. So we put the lens on, they go, I can't see. And you say, well, it's okay. So yes, absolutely. So that's my goal in talking about efficiency. It takes a while to put the trial lens on, let it settle, all that. And, so I'm very excited that this will be coming, and I think that is the future of scleral lens fitting.
It takes a while to get the fluorescein off the patient's shirt once you've spilled it on there. Anyways, do you have any tips as we bring this to a close for the audience about using this piece of equipment, or how you manage it in the office?
It's just part of our routine. When we see a new patient, it's very important. My tip is use your staff. Use your staff to the maximum that you can. The patient comes in, we take their history, we take their essential measurements. We do a pinch cam on them to look at that. We do the Eaglet on them before I even see them. Before I even see them, and then I see the patient, talk to the patient, verify a subjective refraction. We've already picked the lens, and then they go right to that. So it's great. This is a first step in the patient flow in my office.
Right. Well, that's great. Of course, Dr. Arnold, you are changing lives with fitting these scleral lenses as an example. And it's beginning with using this instrumentation. And I think that's really terrific for the patients.
It
Thank
really
you very
is.
much.
Well, it's been my pleasure. Thanks for having me.
Thank you very much for listening. We're here from the Eaglet booth at the Global Specialty Lens Symposium.